get it and all of that, and then we can continue the conversation from there.
All right, so osteoarthritis. So maybe I'll start again from what arthritis is. So arthritis, basically, it has to do with two words, arthro and then itis. So arthro has to do with your joint, and then itis has to do with inflammation. Okay, and for you to have arthritis, there are different forms of arthritis that a patient can present with, depending on what exactly is happening. So if you have some inflammation of the joint as a result of an autoimmune condition, so autoimmune has to do with maybe yourself attacking itself, okay? So your immunity goes in an overdrive where it attacks its own self. It can't distinguish what self is from non-self. So when that happens to the joints, then we see you have rheumatoid arthritis. Okay, then when you have joint inflammation as well, and the main causative factor has to do with maybe some bacterial cause of some sort, then we can say that it's septic arthritis, or an infection process, then you see it's septic arthritis. But then when it comes to osteoarthritis, it has to do with the cartilage. So when you take the anatomy or the architecture of the joint, the joint is formed usually when you have one or two, in fact, 2 or 3 bones coming together, okay, for them to be able to work harmoniously, to help with your locomotion, to help so that you can move and all of that. So when you have these joints or these bones coming together, usually the surfaces of the bones are covered by this, maybe I should say, gel-like or gum-like structure. Okay, so that gummy-like structure is usually the cartilage. And this cartilage usually would have to be very smooth, okay, to help with the gliding action of the bones when they are in motion. Okay, so when this particular cartilage ends up undergoing some degeneration to the extent that now you have the bone surfaces coming into contact with each other, and then you have the gliding action, then we say that you have osteoarthritis. It's actually a chronic condition, and usually we say that you have some risk factors for you to be able to qualify as you having osteoarthritis, and one of them has to do with aging. So as you age, about 40 years and above, definitely you may end up with some osteoarthritis and genetic predisposition. So when you have a family history of, oh, okay, this particular family, all the elderly people ended up with some osteoarthritis at some point in time in their lives, then you have some genetic predisposition and you need to look out for that and then prevent it. Then also obesity. Okay, overweight and obesity, having your BMI greater than about 35 is another very important risk factor that can predispose you to getting osteoarthritis. And you know, weight is very important. We need to be able to manage our weight. So if you don't manage your weight appropriately and you end up being either overweight or obese, it means that you're going to put a lot of pressure, a lot of force on your joints, and this can lead to that degenerative process that we are talking about. And then also sometimes injuries. So when you have injuries to the joint and these joints are aligned or are fixed, and you don't get the correct alignment of these joints, it means that the joint is going to be malaligned, and that will mean that there will be some forces that would end up causing degeneration of these cartilaginous structures, and then eventually you may end up with osteoarthritis. So basically, this is in a nutshell what osteoarthritis is. But what will patients come to you and complain about is one of the most important things we should look at. Some would say, oh, anytime I wake up, my joint, I can't. I have a lot of pain, you know. Some would also say that, okay, I've noticed that over the period, I've noticed that anytime I wake up, I have stiffness associated with my joint, so I can't even move it the way it should move. Some may also say that there's swelling associated with the joint. So all of the signs and symptoms associated with some inflammation or inflammatory process is what these patients will present with. And it may end up affecting how active they are. It may end up affecting how they would be able to even do their daily activities. And that is why it is important that we shed more light on what osteoarthritis is.
Last week, somebody said to me, you know, that he watched the show and wanted to find out whether it's true osteoarthritis, has got no cure. Is it really the case?
Yes, so I would say, so we'll go back again to the basics where we said that is the cartilage. So the cartilage, usually it doesn't have blood supply. And usually when you don't have blood supply, when there's some destruction to that structure which doesn't have blood supply, it's very difficult to regenerate. Okay, we may even say that it doesn't regenerate at all. Okay, it's cartilage. So if it can't regenerate, the only thing is that you can only put in measures that will slow its progress. But you can't for sure cure it and say that, no, I have cured this person of osteoarthritis. So
it's true that it can't be cured?
It can't be cured, but you can just manage it and then slow down its progression.
So does it happen wherever you have cartilage? So like your fingers, it can happen?
So it can happen at some where your synovial joints are. So it can happen, so your knee joint, your hip joint, and sometimes even your shoulder as well. And then some of the distal phalanges too, you may end up having
So people say don't crack your... Can it get you?
Well, for that, no. It doesn't have a direct relationship with you getting osteoarthritis. The main important thing is that if you do have an injury to any of these joints we are talking about, and these injuries, it could be that maybe it's just the joint capsule that has been damaged, or it could be that it's the ligaments that are stabilizing the joint that has been damaged, or it could even be the synovial membrane and the synovial fluid that has an injury. So when all of these are not well aligned or are not well managed, you end up having some malalignment, and then if this particular joint is still being moved, it means that it is going to cause degeneration of the cartilage, and eventually you may end up with osteoarthritis in the long run.
There's a message here from a viewer who wants to find out what therapeutic options are available for, in terms of treatment.
Treatment, okay. So for osteoarthritis, most of the time, or for arthritis in general, you would want to basically make sure that you have diagnosed the patient as much as possible. So first of all, I would advise that you quickly move to the hospital, and then you perform some lab investigations as well as some radiological investigations. So lab investigations to help you to be able to make or confirm the diagnosis. So there are some metabolites. When I mentioned arthritis in general, sometimes even you having accumulated something we call uric acid can end up giving you pins and needles around your joints, and that is what we call gout. Okay, it's another form of it, another type of arthritis. Okay, so you need to have some labs done. Aside the labs, you need to have radiological investigations done. So an X-ray needs to be taken. And then you have to marry all of these, your investigations, your hematological investigations and your radiological investigations, as well as the history of its occurrence and then the risk factors that the patient has. And then you would be able to make the diagnosis of osteoarthritis. On your x-rays, basically you see some osteophytes. You see that there's some degeneration of the cartilage, as well as these bony spicules that you see as osteophytes around the surfaces of the joints that is involved. Once that is done, then you need to be counseled. So you are counseled about the fact that possibly your risk factor at the time may be obesity. So you need to be able to manage your diet. You need to make sure that you are eating right. You are eating the kinds of foods that will help reduce your BMI so that it gets to normal, so that you don't end up having a lot of pressure, a lot of weight that would pressurize your joints. The other thing is that you need to go into your family history. If you have that family history of genetic predisposition, it means that you need to be taught to recognize some of these signs and symptoms even before they happen. Okay, and you need to be very careful. And then physical activity. So physical activity, people may say that, okay, if I have pain, then it means that I shouldn't engage in any physical activity. But no, that is wrong. You rather would want to engage in certain exercises that would help keep the joint in a healthy way. So you need to be still exercising and then going on with your daily activities. The other thing too is that pain is one of the things that people may not be able to tolerate. So based on your degree of pain, the appropriate management is given. So if it's mild pain, then certain times you can give the over-the-counter medications, or over-the-counter analgesics may suffice to be able to manage your pain for that time period. But there are certain times where people who are not educated about it continue to indulge in all the wrong activities, and then eventually ends up in very, very bizarre or very bad states in the end, where the whole joint may be destroyed. If the whole joint is destroyed and it's affecting the locomotive function of the joint, then eventually that means that that joint may end up being replaced. You may have to have surgery to have that joint replaced.
Sounds scary.
And then there are times too where you would advise patients to use knee braces, you know, to help so that they don't hyper extend the joints. They should use
walking sticks.
Or canes. And then there are times that they should be able to use good fitting shoes, so that they don't end up using some shoes that do not fit well and then eventually end up causing more harm to their joints than it should be. Yes.
I've seen, so I went with a family member, same problem, and they used an, I don't know what, I've forgotten the name of the thing, but they used it, and it was like an injection.
Okay.
So they found in between the knee and the leg and the, what's this called? The thigh. So I guess the cartilage there, pushed the needle there, and then pushed in the drug so that it could be a bit lubricated. Is that the word?
Okay, so usually your normal joint usually has a lubricant, and is the synovial fluid. So you have the joint capsule, and then the joint capsule is lined, the inner lining of the joint capsule is usually the synovial membrane. And this synovial membrane would produce your synovial fluid, which will act as a lubricant, would act as nutrition for the joint, and then also would act as a shock absorber. You get it? So sometimes, even when you have this degenerative process occurring, it tends to affect all these parts of the joint. So it's likely that this may have been a local way of having to deal with some joint anomaly of some sort that you noticed or you observed.
It gave them a bit of relief. So
Yeah,
I guess that's a good thing.
Definitely.
But
Definitely.
you mentioned that sometimes over-the-counter medication is
Yeah.
given. Are people at a risk of getting addicted to?
Okay, so over-the-counter medications are usually not medications that have dependency.
Okay.
So they are sometimes some paracetamol, for instance, you can get it over the counter. But then certain medications that you can end up being dependent on, you need prescription for it.
Like
so those are
tramadol.
not, yes, so those are not,
This are
exactly, yes. So those are not, ideally, if we are following all the rules and regulations, those will not be part of the medications that you can easily go to the pharmacy and then get it. So over-the-counter medications are some NSAIDs, and then some paracetamol or acetaminophen that you can get. And then the doses are also usually very low, to the extent that you don't end up getting dependent on these ones.
There's a question here. Hi, what conditions does a patient have to be in to do knee replacement surgery? That's from Siemens.
All right, so as I mentioned, all of these signs and symptoms should be at the very end of the spectrum, such that the patient will not be able to function again. And then when you look at your investigations from your x-rays, you have noticed that the joint is totally gone. So in that regard, then you can opt for a joint replacement. And even that, you would have to look at other factors. If the patient is motivated, highly optimized in terms of nutrition and all of that, before you can actually qualify for a joint replacement surgery.
Wow.
Yeah.
Yeah. I wanted to know, common maybe myths and misconceptions with osteoarthritis.
Osteoarthritis. Okay, so people may say that, okay, so osteoarthritis, it's basically a disease of just the elderly, and once you are young, you may not end up with osteoarthritis. Yes, it's true that it is a disease of the elderly. We say that after 40 years. But then, looking at other risk factors, like the genetic predisposition, if you do not indulge in the right activities, you may end up with osteoarthritis at a very much earlier age than that. And then people may also say that, okay, osteoarthritis, once you have osteoarthritis, it is, you need surgery. But as we have just explained, osteoarthritis is not something that we want to manage it so that we can prevent, we can manage the signs and symptoms, and then not get to that end stage where you would require some, what's the name, surgery, which is the knee replacement surgery. So there are a number of things that people, misconceptions about.
But after the surgery, you know, do you find that you're able to walk like normal?
Yeah, so you'd have to undergo some physiotherapy.
Yeah.
So yes, definitely you have to undergo some physiotherapy where you are taught again how to walk, how to how to adapt with these new prostheses that you have. And then basically once you go through the physiotherapy, you should be able to get back to normal function.
There are concerns around, still on the stereotypes, right?
Yeah.
The weather and its role.
Okay.
Are you able to briefly touch on it for us?
Yes, so definitely. So arthritis in general, yes, there are some of these arthritic conditions have cold intolerance. So cold intolerance in the sense that once the weather is cold, it's either leads to something we call vasoconstriction. So vasoconstriction is at least the pipes that lead to, that supply blood to the area become more constricted, or they become narrowed. So once this happens, it means that the blood supply to the area is reduced, and then it can lead to the pain that you end up having. There are certain times too where even the cartilage and then the tendons of the muscles that help with the function of this joint become stiff because of the weather conditions, and that can also lead to some pain because of the stiffness of the joint. And then, but typically the one that is associated with cold intolerance would be the rheumatoid arthritis, the autoimmune type that I mentioned. Osteoarthritis, yes, a little bit, maybe mildly, yes, some people may have some cold intolerance, but then for the autoimmune type, yes, it is known that it has some relation to do with some cold intolerance, and even sometimes you may even call it the Reynolds phenomenon and what have you. So yes, it is there.
Still on the stereotypes, and I like that you're debunking a lot of the wrongly held perceptions, but there's also another that says that, for example, if you are suffering from it, you shouldn't gym, right? And that your physical activity should be constricted to a particular form of exercise. Is that really the case?
All right, so when you have osteoarthritis, you need to be active, physically active. But then again, we still have to come back.
There's a but.
Yes, you need to come back to what exactly is causing your osteoarthritis.
Okay.
Is it from injury? So if it is from a particular injury, maybe a ligament tear that has been wrongly fixed, that has led to malalignment of your bones, and then now your bones are degenerating, or the cartilage in between the bones are degenerating, then it needs to be measured. Okay. So you would be taught exactly what type of physical activity to do so that it doesn't rather end up causing...
Yeah. So it's not like you can go to the gym and start lifting heavy metals and dumbbells and, and all of that.
So you would have particular exercises, because that is also very, very important to maintain the health of that particular joint.
Can you get osteoarthritis from going to the gym?
From going to the gym?
Yes.
So if you have an injury from going to the gym, indulging in a particular, maybe doing
heavy weights.
Exactly, that leads to a particular tear or a particular injury to a particular joint, which hasn't been managed properly, and then you keep using that particular joint in the wrong way, then yes, it can lead to malalignment of the joint, and that can lead to the degeneration of the cartilage. So it's one of the risk factors of having osteoarthritis in the long run.
You've spoken a lot about the relationship between obesity and osteoarthritis.
Yeah.
It's going to be a long day.
Drink water.
It's going to be a long day. You know, would you say there are certain foods, for example, if you check your BMI and, you know, obviously points to the fact that you're obese, you should absolutely stay away from if you begin to experience the symptoms talked about?
So joint health is not different from your overall health.
Okay.
So it's important that we all know the foods that are good for us and then the foods that are bad for us that will lead to you putting on unnecessary weight and then eventually putting your knees and then your joint at risk.
Some people eat certain foods and that's absolutely nothing to their body shape.
Yes. So it also
people
has
eat
to...
it and sometimes they only smell it. And their body just begins to change.
That also has to do with your genetic predisposition.
Okay.
And then the fact that some people are high metabolizers and then others are low metabolizers.
Yeah.
High metabolizers are, okay, as soon as I eat something, my body is able to quickly break it down and then it becomes energy and it is used. While others who are low metabolizers, whatever that you eat, it doesn't break down. It rather goes into storage.
Yeah.
So you need to know your body type. That's why some people may put on a lot of weight while others would not put on any weight at all. So it still boils down to the fact that you need to eat healthy. So how do I eat healthy? Incorporating some fruits and vegetables in my diet almost all the time. Making sure that I reduce my carbohydrate portions so that I eat more of my proteins, and then making sure that any meal that I'm eating should have all the vitamins and then all the minerals that there should be in that particular. You should have a little bit of fats and oils, you should have a little bit of your proteins, you should have your carbohydrates and all of that. And then making sure that you're hydrating as much as possible. You're hydrating as much as possible. Very, very important for you to be able to. And making sure you're also checking your BMI or your weight almost every time. You see, it's important because people don't even know what BMI is.
You showed us the calculation
the last time. Yes. So you should make sure that anytime, maybe even once a month, you can just check, or you can buy your own scale at home, and then you stand on it. And then you check your weight. Once you get your weight in kilograms, you should know your height. Your height usually would not change. So your height, it should be in meters squared. So once you have your mass or your weight in kilograms and then your height squared, you divide the two. That should give you your BMI.
Yeah, and a healthy BMI
is usually, yes, so it's usually between about 18. So once you have about 18, yes, that's normal. If it's below that, that's underweight. And then if it goes maybe 18.1 all the way to about 20 thereabouts, then you say, okay, the person is still, so 18 to about 24.9 is normal.
Wow.
So if it's below 18, then you're underweight. And if it is above your 25 to about 30, you're overweight. And then when you have about 35 and then above, then you know you're in the obesity range.
Wow. People say it's usually very common or extremely common among older folks, so much that it's negligible among young people. So don't even bother, right?
Yes, yes.
Is that really the case?
Yes. So we mentioned that once you have other risk factors, like the injury that is not well attended to, like your BMI is not restricted to elderly people. If you have an unhealthy BMI, you do have an unhealthy BMI. It's irrespective of your age. So once you have all of these things, you're at risk of developing osteoarthritis, and not necessarily the fact that you are above 40 years, as we have mentioned earlier. So yes, it is something that happens with age, but when you look at other risk factors, you can end up having osteoarthritis even at your young age.
Wow.
Can osteoarthritis be confused with other joint conditions?
Yes.
And how they
yes. So
differentiate
so
it?
this arthritis that we even mentioned, I've mentioned a number of them already. the ones that are caused by the autoimmunity, which is your rheumatoid arthritis, the ones that are caused by accumulation of some metabolites like your uric acid, which is your gout, okay? The ones that may be as a result of when you look at it, there is some causative organism which can be isolated. So maybe a bacterial infection, which is your septic arthritis, okay? And then there are other injuries associated with your joints. So if you have injuries that are affecting some of your ligaments, yes, you can end up with some pain. You can end up with some stiffness. You can end up with limitation in movement. And all of these can mimic some of the signs and symptoms that we have mentioned that do happen in osteoarthritis.
Yeah.
It could also be that aside the fact that you have some injury to the ligaments, you may end up having some malformed bone itself. So the surfaces of the bone that is in contact, or that is caused, that will be in that joint, has it's malformed.
Yeah.
Once that is malformed, yes, you can end up with some other joints. And then the joints anomalies can be varied. It can be degenerative. It can be from an injury or trauma. It can be from a metabolic source and all of that. So yes, you need to be thoroughly investigated. Thoroughly, you need to be, a good history needs to be taken, and then the right diagnosis needs to be made before the right treatment would be given to you.
I think at a point you spoke about shoes. Can wearing heels or the wrong type of shoes?
Oh yes, of course, yes. For our females, for our females, yes.
Sometimes
Very, very
a
important.
heel you may wear, but still, nah, that's the one that I want to wear.
Exactly, very, very important, right? Wearing the right footwear, which is comfortable.
Yeah.
Footwear that would not cause your joints to be malaligned, to the extent that now when you are walking, it causes you have that gliding motion of the surfaces of your bones that can lead to that degenerative effect. Yes, it's important, especially for the ladies when it comes to this. Yes, especially for the ladies. So it's very important that you know the right types of shoes that you should wear, so that they are comfortable and then they don't end up causing unnecessary pressure and forces to the joints that we are talking about. And eventually you may end up with an arthritic condition that you don't want.
Well, my final question. I hear people say that if you're managing it, for example, you need to check your sedentary lifestyle, right? If you're an office worker, don't sit down for long hours. Are there like very quick exercises, quick physical activity? You
should be able to. Yes, you can be moving your feet. If it's in your knee, you should be able to do even the soleus exercise, where you just need to move your ankle. Once you're moving your ankle, at that point, it's able to at least help with some blood supply to the region to help reduce the pain that you may be having. Even little massages on the joint could help. You